afternoon. I'm so happy that you are here to hear about MyLeap, which we think is a fantastic program that leads the way for childcare solutions. My name is Beverly Walker Graffia, and I am the executive director of MyLeap. I'm just so happy that you are here so that you can start listening to the whys and what's happening with one of our best child care solutions for our employers and the workforce. We know that many of our families' access to affordable child care is not just a family issue. It's an issue for businesses who are struggling to keep talent. It's an issue that prevents economic growth, an issue that requires a practical solution. And here in Michigan, we know how to handle things with a practical solution. Don't you agree? Oh, that's so. Don't you agree? Okay, there we go. Parents are making real trade-offs now. They're leaving jobs, cutting hours, changing academic or workforce training plans, turning down opportunities that would help them improve their economic viability for them and their children. When surveyed in April of 2023, we had parents that stated, due to unforeseen high child care costs and the availability of child care providers, 14% had left their jobs in the past 6 months. 14%. 52% needed to make a significant adjustment to their school or work training. Well, what does that mean for us? It means that we lack the child care options that directly impact the bottom line, not only for the parents, but for our businesses. Employers are faced with ongoing hiring challenges, high turnover, lost productivity, and the inability to fill shifts. Childcare allows many parents to work, stay in school, attend a training program, and fully participate in the economy. Simply put, if our parents don't have adequate child care, they have greater difficulties showing up for work without putting their children in harm's way. And unfortunately, we have seen the headlines about that happen too many times. In Michigan, we estimate that child care gaps cost the state $2.88 billion annually, which includes $576 million in lost tax revenue. This trend is happening across the country, but Michigan has set out to be an exception. The leaders that you see on this panel today have recognized that supporting child care is not separate from a business strategy. It is a part of building a stable, reliable, and workforce for our employees. While families were struggling to find and afford quality child care, our government leaders, employers, and philanthropy came together to build this awesome program named MyTriShare, which is a lifeline for Michiganders. What makes MyTriShare important? Well, it is the moment that we're living in. Right now, we have to have something that meets the demands right now so that our parents can work. What started off as a first-in-the-nation pilot in 2021 has led to $14 million in savings for families, covering costs for 1,200 of Michigan's children. And today, I'm very excited to announce that MyLeap just signed up its 300th employer partner. Yay! That means that that's 300 employers who are offering the MyTriShare benefit to over 1,000 eligible employees. MyTriShare covers two 2/3, or 66% of the child care costs for the parent, which lessens the family's burden. 1/3 is paid by the state, 1/3 by the employer, and then 1/3 by the individual. It's practical and it's centered on helping our working families stay connected to their jobs while they can find comfort in knowing their children are in safe, quality learning environments at a critical stage in their lives. So this conversation is going to be a great example of the kind of collaborations we need more of, bringing together all the partners to solve challenges that no one sector can solve alone. This afternoon, we're going to talk not only about the success and growth of My TriShare, but also about what we've learned, what challenges remain, and how we've committed to building a system that better supports Michigan's families, employers, and the future of this state. So to start, I'm going to ask our panelists if they would introduce themselves and share what is their connection to the My TriShare program.
Sure. Good afternoon. My name is Megan Russell Johnson. I'm a program officer at the W.K. Kellogg Foundation. The Kellogg Foundation is based in Battle Creek, Michigan, and we have teams operating in Detroit and Grand Rapids. We also work throughout the United States, internationally, and with Southern tribes. With children at the center of everything that we do, we support solutions, efforts, and programs that change systems so that they work for everybody. And my involvement in the TriShare program is I served as the program officer on the grant that the W.K. Kellogg Foundation made to support TriShare during the pilot phase.
And I'm Kelly Saunders. I'm the Vice President of Policy and Engagement at the Small Business Association of Michigan, not to be confused with the Small Business Administration, which has a much healthier bank account than we do. But we have been a part of the TriShare program since before its inception. It was one of the first business organizations around the table to help figure out how this would be structured and then implemented. But my time with TriShare actually started, I serve on the Michigan Women's Commission, and when this program passed through the legislature, the question was, where would this be housed? And it was put within the Michigan Women's Commission to start before it headed over to MyLeap, where it is being taken good care of now. But SBAM is heavily involved in supporting workforce initiatives that make sure that employers and employees can have healthy relationships and have access to certain benefits that obviously promote healthy workplaces. And so we're honored to be a part of here, be a part of the conversation.
Thank you. I'm State Representative Greg Van Workum. I represent the 88th District, which is Norton Shores, Spring Lake, Grand Haven. And when I was first elected, I was focused on child care. I saw it as an important issue for the district, important throughout the state. And as Kelly said, we kind of put a work group together that was meeting at SBAM's offices with a lot of folks and stakeholders that were interested in it. And one day I went to my desk and grabbed a sheet of paper from the printer and started writing what became TriShare. So kind of an architect in it, but certainly had a lot of help and support along the way to finalize what it's become. And I don't know if finalize is the right word because it's still kind of evolving
Right.
as we're talking about it. But that was my role in TriShare.
Okay. So for this panel, we're going to ask questions that were prepared, and then we're going to open it up at the end to let you ask your questions as well, and then we'll close it out. I'm going to set some context, I believe, and I would like to, start with Representative Van Workum. Michigan TriShare was created because families and employees were experiencing the same challenges, just from different perspectives. Child care was recognized by both that it was a barrier to work, and it was crippling the stability of both families and businesses. So if you would share, why did you choose to sponsor this program and take this challenge on? And then how has the program matched or challenged your expectations?
Sure, thank you. So prior to being a state representative, I worked for a congressman, would go to a lot of meetings, and a lot of meetings with employers. And the top three issues they would talk about as a barrier for their employees was transportation, the skills necessary, and childcare. It was one that you just never heard of. And people were just kind of starting to talk about it as an issue. And I just kept on hearing this over and over. And then at one point, I served on the local United Way board, and that was one of the major issues that they were talking about it. And then you kind of start looking at it. And childcare was always before talked about as an early education or a healthcare issue. Those were the departments that were very much involved, along with Lara. But nobody was looking at it as a workforce development issue. So I thought, why not try and take this and think about it more as helping employers and getting another entity involved in the conversation. And so many times through my work, you were just hearing of this talent that was leaving the workforce, usually young women that had exceptional talent but decided to stay at home. And I had the same issue at my home at the kitchen table of how do you make this work? We had the debate, all right, does one of us stay home? Does this make financial sense for both of us to work? So it was a lot of real life of having done it personally, but just seeing and hearing from the employers and everyone else that this was a major issue that needed, in my mind, a different approach. Rather than your traditional subsidies or from the government or another tax-free account, which are kind of your typical two sides of a spectrum of how to approach this. But if we got employers more involved in that, how could that affect the change and get the engagement and help out? So that was kind of the premise of how I was thinking about it at the time and kind of how I started developing it.
So has it met your expectations, or?
You know, you hear the statistics that you mentioned. There was certainly some growing pains there, but now I think there was a lot of questions about it and getting people engaged about it. I think there's some things that, you know, on paper we thought would work a little bit differently, and that still may come about as time moves on. But I think there was frustration of how slow it's gone, but now that it's been picking up and moving, I'm very proud to be sitting on this panel today.
Great, I'm glad, because I'm the executive director. So philanthropy has played an important role in helping establish and expand the initial My TriShare pilot. Megan, from the Kellogg Foundation perspective, what made My TriShare a compelling investment in terms of addressing gaps that still remain in Michigan's child care system, and what is the long-term impact?
Yeah, well, thank you for the question. So when we first invested or made a grant to support TriShare, it was in 2021, which was right in the middle of the pandemic or after, and the effects were still being felt by working families. And so this seemed like an excellent, very responsive solution or a solution to help families get back into the workforce, particularly women who left the workforce in higher numbers during the pandemic. The goals of TriShare align with the priorities that we have at the Kellogg Foundation to increase access to affordable childcare, to remove a barrier for families entering the workforce, to help stabilize the economy, to help support childcare in having secured slots and dependable numbers that they can rely on. So all of those goals aligned with our goals at the Kellogg Foundation.
When you, or the Kellogg Foundation, was actually out in the community and talking to families, what did you hear that made you say, this is what we should do?
So we're hearing great things from families about the impact of TriShare. Those who are able to access it, it has been life-changing. It has allowed them to work the hours that they choose. It's allowed them to work in the ways that they have hoped for. Specifically, I have some examples from a family. There was a woman that already had a child in the child care system. He was 2.5 years old. She was having twins, and she was very concerned about being able to afford child care for 3 children. And her quote was, "I can't afford to work, but I can't afford not to work." And so when she was able to access TriShare, it allowed her to stabilize her family, to gain access to employment. However, we know that there's still a lot of families that don't have access to TriShare, and we know that families in Michigan right now are continuing to struggle with rising costs. In fact, the WK Kellogg Foundation, in partnership with the Steelcase Foundation, recently commissioned an EPIC MRA poll and found that 1/3 of families struggle with basic needs like groceries. And 2/3 of families are very concerned about these types of things, the same poll showed. And so TriShare is having an amazing impact, and more needs to continue being done to support families.
Certainly, certainly. So Kelly, from the employer's perspective, for this model to work, employers have to see child care support not as an extra benefit, but as a part of their workforce strategy. How are small businesses reacting to my TriShare? What do you think is working well, and where do we have friction points?
Sure. So we represent 33,000 entrepreneurs across Michigan. SBM is the largest small business association in the country, which speaks to our entrepreneurship here in Michigan and how people see their dreams and they chase it. And so one thing about our members is that they're very practical people. But there's always some like healthy skepticism to it. And so when they hear a program, it's like the government is here to help you. They kind of take a step back and say, okay, let's talk about the mechanics of this. And so people do have a genuine interest in learning about the program, but it has to be practical. And so explaining, how do I budget for this? How many people in my company would be eligible for this? How do I put all these steps into place to make this work for my company? It sounds great, but I need to be walked through the process and being able to access this, and also not making my employees go through the eligibility screening if they're not eligible for the program. And I do have to give MyLeap a lot of credit with starting to integrate the CareShare method, where maybe they don't qualify for the TriShare program altogether, but gets them in the system to be connected to it. And so when we talk to employers about it, there is some great interest in it. And people who have participated in TriShare, they will talk up and down all day long about how people should get involved in the program, because they see a lot more stability within their workforce, that when their employees know that they can drop their kids off to a home base or center base, whatever it may be, where their littles are cared for, that they have obviously a much more stable workforce and a healthy workforce to come to work and know that their kids are taken care of so they can do their jobs. And so it's a great program. Is it the only answer? No, it's not. We know that the childcare industry is complex, and every family is different and requires something different. But we have to have tools in our toolbox like TriShare for employers and employees to access, so that we can start to alleviate this burden, so that our workforce is able to focus on the task at hand, making sure you're thinking about the employee holistically so that they can feel good about coming to work. But I do want to put the notation on it that employers are not that different from their employees. These employers are going through the same thing as their employees. They have families. They have a hard time paying for childcare. And so this idea that, it's up here and down here, that's not true. They're going through the same thing that their employees are. And so this is a good business decision for them, to think about that this program could be not only as assistance to their employees, but also to them as well. I would say from the friction point, and we'll probably talk about this down the line here too, when we launched this program, calling it a pilot was not our best friend. Because people think a pilot stage lasts forever. It's like, nope, we're beyond the pilot stage. This is a real program. It's happening. It's proven its worth. It's thank you. I know this is important to you, but you and your colleagues do fund it in the budget every year so that there is access to it, that we can continue to grow it. When people hear pilot, they think, oh no, this program could go away. And so how do I offer something to my employees that may not be assured, because the last thing they want to do is give something to their employee and have to take it away. And so I would say that's the biggest thing that we encounter when we're talking about this program, is getting past that hurdle that this was a pilot. No, this is the real deal. We're doing it. We're all in it together. But small business owners care about their employees like they're their family. And so we've got to make sure to kind of overcome this hurdle that we involuntarily created from the beginning.
Do you feel like, or maybe the question is, thinking about the productivity of our small businesses,
Sure.
How has that changed?
I would say for people who participate in the program, it's been great, right? You have families that have a place where they can take their kids. They know that they're healthy, safe, that there's, stability within not only, their work life, but also their home life. And so those that have participated, we've heard, a resounding, this is great, this is working, my employees are happy, I'm happy, their families are happy. And it's just a great tool to have in the toolbox to retain that talent within their own business, because not everybody can offer this benefit. And so having an employer that understands the needs of their children, that speaks volumes to people that are looking for work, specifically in a small business, that want to give back to their communities.
So one of the reasons my TriShare stands out is because it brought together all those partners that I talked about during the beginning, who may not always approach solutions the same way. But what they said was that they were going to agree that there is a problem, a common problem, and that we need to collaborate to make this, or to have a resolve for the issue. Representative Van Workum, what made my TriShare a viable bipartisan solution, and what lessons can we carry forward to apply to other workforce or family support policies?
Yeah, I don't know if it was bipartisan at the start. It was, I guess, something that we were going to try and get out there, and I think it's become bipartisan as we moved forward. It's not to say that it was partisan. It was just kind of out there, and then we just kind of got people on board to move it along. And I think what is trying to solve a problem in a different way. Like I said before, we've tried the other ways many times and just got the same result. So when we put it as a pilot, we put it in 3 different areas that we knew were working on this issue and had some foundation kind of put in place. In Muskegon, which I was obviously familiar with and knew that they've already put a lot of legwork in trying to address the child care issue. Up in Traverse City area, they were working hard on it as well. And then in the Saginaw area, and we kind of also wanted to make it rural and urban and yet allow some flexibilities that they could figure it out as they went along. What was working, what wasn't working. Kind of had some parameters, but yet some flexibility within there so they could figure it out, because obviously Traverse City issues aren't the same as Muskegon issues. Muskegon issues aren't the same as Saginaw. So we wanted to have some in there and just overall kind of figure it out. The second part of your question on potential other areas this could work in. So now, in my role in the House is I'm the chair of the Medicaid and Behavioral Health budget, which is one of the largest budgets we have in the state. But when I was putting together TRICARE, the Muskegon folks were already kind of working on something similar in scope with healthcare. and sharing a healthcare clinic, right? In your industrial zone part of town, you got 5 major employers that work well together, not necessarily competitors, but they, all work well together. And they were having an issue with employees, having to leave work for 5 hours, or having to take half day off or whole day off just for their doctor visit. So they came together and put some money together and worked with the state and figured out kind of just having a healthcare clinic near the area, so that their employers had somewhere to go and didn't have to be taken out of work for a full day. So there are things like that, but when I put together the TRICARE stuff, I really thought it was going to focus on the employer side. And I really was pushing that the employers kind of come together and say, hey, this program's out there. How about we talk to each other and figure this out, see if we want to set up a hub, and then we can offer child care services to our employees. Now, I think some have done that. Some has been more government-run side. Some have been more of a nonprofit side that wants to be the hub. But I've always thought in your announcement today of the 300th employer was a critical part to this, that the employers come together and say, hey, there's this program out there. What do you think? You want to kind of be a part of it with us, and we can work with this hub and put it together? I think that was a key part, and I think with more of that and more of conferences like this and the chambers across the state talking about that, I think hopefully you'll get that more employer engagement to be a part of it and really make it take off.
So Representative, if we were able to expand My TRISHARE, what policy adjustments or investments would you prioritize?
On the TRISHARE side, obviously, as Kelly said, it's still a part of the budget. I'm introducing the legislation. We're hoping to do it this week, but you always have issues with the bill writers. But to make it a law and put it in statute will make the budget process a lot more easier moving forward. You want to see more employers engaged and having everyone engaged. As it was said in the panel, I think this is just a piece of the child care issue. I once had a senator call me saying, this isn't enough. I had somebody testify before a committee and going after TRICARE, and it's like, well, hold on. That's not what TRICARE was supposed to be. TRICARE wasn't here to solve all of child care issues in the state and the affordability issue. This is supposed to help that kind of missing middle, right? This is supposed to help the person that's getting that first job, but it pays well above the FPL rate than a normal job. This is trying to help create that ladder to prosperity for whether it's a single mom or a young family. This wasn't supposed to solve all the child care. This was supposed to kind of fit this segment. So I think there's other issues that need focus on the child care side, particularly the deserts and the availability of spaces. A part of the child TRISHARE that we originally wanted to do that I think there still needs some work is the guaranteed slots. That a employer comes into a memorandum of understanding with the hub and the other businesses that put together the hub, that they need guaranteed slots for somebody may have left work, but they want to keep that slot because they're going to hire someone in, and how to do that to make sure that the child provider is still receiving income, because they are going to quickly search for somebody to fill that spot. How do you keep that spot open for an employer that's working on hiring somebody, someone new? So I know other states, I've heard other states are kind of looking at that part, but that's always been kind of a component of TriShare that I don't know if we've figured it out yet.
So Megan, from a philanthropy perspective, what's the responsibility that philanthropy has in sustaining programs like My TriShare?
So for philanthropy, an excellent role is during that pilot and innovation and learning phase. To scale a program in general and TriShare, that really does require public resources. It's philanthropic dollars pale in comparison to what's available publicly. But I will say our support for TriShare supported just that. It was during the pilot and innovation phase. Part of the WK Kellogg Foundation resources went to support the evaluation. And I do think TriShare is a model of taking the evaluation, learning from it, continuing to innovate, and acting on it. And that is exactly what you want to see with the use of evaluation and the use of philanthropic dollars, because it also allowed for flexibility. When something was learned and there was a quick pivot that needed to be made, philanthropic resources can be used more flexibly. So to answer your question, not so much for sustainability purposes, but I think philanthropic resources are very well suited during that pilot phase. I know we're not a fan of pilot, but during the early.
I really stepped into it with that.
During the early phases. But then I also think for ongoing learning as well. If you want to continue to improve, you've got to know what's working or not and why. And so I think philanthropy has a role alongside it as it gets to scale to continue with some of those things that are needed.
So Kelly, when you're thinking about My TriShare on a national basis,
Yeah.
because we've been approached by several states wanting to replicate this, if you were asked to advise other states looking into doing something like this, what would you tell them to make sure that they get it right?
Well, I feel like I need to clear up the pilot
Are
thing.
you gonna
Jeez.
say don't call it a pilot?
I
here?
wouldn't call it a pilot. I'm just going to be honest.
No, it was an excellent point. It was.
Yeah,
It was-
so here's the thing. I love pilots. I just think that the word has scared people off. And so if we can think of an alternative word for pilot, I would love it. Because every time it's brought up, it's like, I don't know, it's a pilot. It's not a pilot. So I'm just like, I feel like I'm out there saying, no, we are not using that word anymore. But it's been great to see the national recognition of Michigan in this space, and I'm sure the representative is very proud of that. When it was in the Michigan Women's Commission and they started to get reach outs on this, I think there was a little bit of hesitation at first to go out there and share because we were in the learning stage, right? And so had the bare bones on how to do this with guidance from Representative Van Workum and his team, but you don't really know how something's going to work until you actually put it into practice. But what we had talked about the Women's Commission is if we're not proud of something that's innovative and people are taking notice of, what are we even doing? And so why not just get out there and talk about how we are learning, that we're taking the structure that had been given by the legislature and talk about maybe some of the challenges, but also some of the amazing things that are happening with families that are participating and how it can work. And so, yes, I would shy away from the word pilot and talk about the program itself and what it's doing for people in such an amazing way, but also don't be afraid to share the struggles, right? Everything is not going to be perfect from the first get-go, and so I think one thing that other states may have benefited from is that when we were sharing some of our struggles, that they were being innovative in their own way. They were still using the structure and the vision that Michigan had created and giving credit to Michigan in all the ways for this amazing pilot program, whatever you want to call it, had been created. But they were also kind of doing spin-offs in their own way because just like us, we're not like Nevada or Massachusetts or Kentucky. We all have different constituencies that require different things. So it's okay to not be cookie cutter to everything. It doesn't always work for every state and what they're going through right now in their respective childcare journeys. And so I would say sharing knowledge across state lines. Michigan has learned from other states too on what they're doing to make their program maybe more successful that can be implemented here. And so taking pride in being the state that actually put it into practice and put it forward, being open about our journey, sharing those lessons, and then taking and sharing their the things that are working for them too, that's the best of all worlds, right? That we can kind of grow and build off of each other, but also take credit for being the ones that started it. Nobody's saying that Michigan didn't start it. They're all looking to Michigan to share that information. And so I think that is really the framework of it when we talk to other states.
So, Representative, you talked a little bit earlier about, child care is more than just My Tri-Share. There are many different programs out there. Where do you see are the gaps that still remain in Michigan's child care system, even with My Tri-Share in place?
I'm glad you got that one.
Yeah, right. Thank you. You still have the provider side, right, of having enough providers in the state, in different regions. We talk about the deserts that exist yet in the state. I've attempted to do some things on that, but a lot of that is the funding side, just to get the startup side going, and having people set up. Because one of the major issues and why we went with the Tri-Share model is we were hearing of employers trying to do this. Employers trying to set up their own child care. And as many times as you heard them try and set one up, you heard about them closing one because they couldn't do it. It was too complicated, too many issues between DOE, LARA, DHHS, that they don't do childcare. That's not their business, right? So there was just that frustration. So it was, how do you then approach it in a different way, which was Tri-Share. And that's why we kind of came up with hubs, because they were the experts. They were the experts in knowing what they needed to file with LARA and DHHS and DOE and the others. And going to your previous questions of one of the things I think you can improve on the Tri-Share is I also thought the hubs would have a little bit more, because I wanted them to be an expert so that they could help not only the employer side, but also help the provider side. That's why it's the hub and spoke, because they're also helping with the providers. And I apologize, I talk with my hands. I get that with my dad.
I'm doing it too.
To increase their kind of centralness so that they are talking with the providers, they know which slots are open, they're helping the providers with filing their notices with LARA and things like that. That's kind of what we wanted the hub to be, so that they had somebody that they could talk to and figure out how to run their operation. And I think there's still some things like that to simplify that, to make it less complicated on the providers, because it is a difficult industry to get into when you're not just necessarily a family in your home, but a whole facility and things like that. So trying to simplify that, but I also think there's finding providers, but also finding the talent as well, and how to come up with programs, whether it's in early childhood or what have you, that you're getting people into that space that want to be a child care provider. Or sometimes it's having an intern, which are very costly, getting their hours in and serving at a child care facility to get some early education credit or something like that can help with the overall cost that is a part of child care. So it's getting more people set up and getting more facilities put in place. So that helps with the supply and demand and getting some talent in there that hopefully can help on the affordability side of childcare.
Megan, same question from
Yeah.
a philanthropy standpoint.
Thank you. Yeah, I'd love to add to that. Truly, one of the underlying causes for challenges and concerns in the childcare sector is it's a business model that just doesn't work. There's a slogan that's used in the field that parents can't afford to pay and childcare workers can't afford to stay. Kudos to Pulse and other partners in the room. It's just such a true statement, and it's part of what makes the field so under-resourced. The model just doesn't work, and so when we talk about recruiting and retaining talent, it's very difficult to recruit people into the childcare field because the wages are very low. A lot of people you will find leave and go to a fast food restaurant or a restaurant down the road and are able to get paid more or have access to benefits or things that they don't have in the field. And we know it's such an important role that they're playing in building our future and educating children, and the outcomes are obvious, that children show up more ready for kindergarten and that they're more successful in school, they're more likely to earn higher wages, long-term effects. So we can't let this affordability challenge with childcare for parents and the lack of a working business model prevent the sector from thriving. We've got to think and continue to find solutions for it. The state has done an amazing job supporting TriShare and Pre-K for All and GSRP. And so there's an opportunity to do more in this space. And that will support TriShare in growing and thriving too. TriShare can't be successful if a community doesn't have childcare opportunities available for families and employers to take advantage of. So we've got to continue to think of it as a broader system.
So Kelly, when you're thinking about this, I'd like for you to put your Women's Commission hat on. And Megan brought out a point about, having enough providers, because that's one of the things that the research is saying. We've got to have that. So what are the gaps for childcare from a Women's Commission standpoint?
Sure. So when pre-COVID, we were tasked by the governor's office to travel the state and listen to the women of Michigan. And pre-COVID, one of the top 5 things, like Representative Workham said, was childcare was always a part of that conversation. Not having enough access to, affordable and reliable childcare, not, being able to work and do both. And then the pandemic happened, and what Megan said earlier, women left the workforce more than anyone. And so then when we're coming out of COVID, people are trying to go back to work, or is this a good decision financially in order to do so? Then we had providers that obviously had to close their doors during COVID because we were, obviously under a lot of executive orders leading, up to it, what have you. It was like the perfect storm of bad. And so, from a Women's Commission perspective, we were asked during COVID to make recommendations in the childcare space on how to alleviate these issues. And so TriShare was a part of that, being able to put together kind of a one-stop shop for providers to be able to go and get all of their licensing and all their questions answered. And I'm not just going to, what I'm about to say is going to sound like a suck-up answer, but it's not. The governor creating MyLeap was probably the best thing she ever did in her entire 8 years, because this department has taken all the facets of childcare for providers, and my good friend Emily is sitting right here, and I adore her, but this is your vision. What you're talking about is creating that space for providers to come to one space and to try and get all their issues taken care of, or to have that one point of contact to get through this rules and regulations that you have to literally do mental and physical gymnastics to get through, to just care for our little ones. These are people that go into this industry that really just want to care for children in the best way that they know how, so that they have a trajectory that is bright. And so when we were going through this with the Women's Commission, and then everything started happening with MyLeap, it's great. right? Like we're starting to see it all come to fruition, but this is hard work that takes years to put together. It's not like state government is easy. Even if you work in state government, you're like, why do we do that? And I can say that because I used to work in state government. So I think sometimes we have to be patient with each other because there's a lot of things we have to undo and redo, and I know you see that every day in what you do. But we're heading in the right direction. I agree with you. The business model for childcare is extremely difficult. And if I can put my SBAM hat on, because I feel like I answered the Women's Commission piece, at SBAM, we really have leaned into the childcare space. A lot of people see childcare as a part of like a workforce bucket when it comes to policy. What we decided to do is we said, no. Childcare is going to be its own bucket. It is a moment that we have to meet, and there are so many members within SBAM that are childcare providers that we have to be here for them now. And their issues are so much different than all the other issues and industry specific that they deserve to have a voice. And so it's very unusual in a business organization to have this kind of very industry specific that you focus on, but we're leaning in. We're all in. We're going to be a voice for these providers because small business providers, these people are relentless in wanting to do what's best for this industry, and they're talking about that business model. But here's the biggest thing for them. They want to change the narrative on who they are. They are not domestic workers. They are not babysitters. These are people that care for our most vulnerable population in making sure that they get into the trajectory to make sure that they're successful and to make sure that those parents know that they've got their backs and their kids' backs every day. And so what we're focused on in the childcare space is making sure that those small business owners that are providers are looked at as business owners, not babysitters.
So I'm going to open it up to you on that note and see what questions you may have. Please.
Thank you.
Looks like we have a mic coming, so because it's being recorded, we need to.
Hi, Kathy Zender-Wilson with Pulse at the W.E.F. John Institute. Thank you all for your perspectives on this. Just a question from a policy perspective, Representative. Are there other ideas you have for incentivizing employer engagement in childcare solutions that we could support, or any other ideas that might be floating around out there?
There are already accounts and things like that you can sign up for and put some money away for childcare and things like that. I haven't heard much on the employer side. I think it's still, as it relates to the Tri-Share program, is that engagement side and getting people knowing and understanding that it's available. And that was kind of a major issue as we were building it, of who would be eligible, because some employers can swamp out the system for how much money is set aside for this. That's why I kind of worked with Small Business Association of Michigan to make sure that they had a seat at the table. So I think right now we're still in that engagement. You always hear of some tax credits or benefits and things like that. I won't go necessarily there, but those are always have been part of the conversation and have been looked at. I said that kind of early on, that there is the tax side and just creating tax credits or creating the tax savings accounts, or it's government heavily subsidizing. And we wanted to stay away from that. And also, to Kelly's point quickly, it was a conscious effort to make sure that we still had child care providers, because a lot of people just want to put this on the schools and just say, why don't we just make this a school issue? And one of the issues with the business model side is when there was a big cliff when we did universal fifth grade, or 5-year-olds, right? That's where child care providers made their money. They didn't have to necessarily pay as much attention to those kids. It didn't cost as much to take care of those kids. That was the margin. And when that went away, they started to really struggle because they were all now in the school system rather than the child care system. So I just want to point that out. But there hasn't been that much more on the employer incentive side that we've heard about, because some of those things are already in place.
Hi, this is Andy Richards with Duncan Aviation in Battle Creek, Michigan. Now I want to look at the other side of the equation, which is the caregiver side of TRISHARE. Is there anything in works to make it easier for caregivers to operate through TRISHARE? You know, as far as getting paid in a timely manner, things of that nature. Is that part of the evolution that you talked about earlier?
They may be able to speak about it a little bit more detailed than what's currently happening, but that was always an issue that we kind of came up with a solution along the way. I had envisioned that somebody would come up with software to handle this, right? There's got to be some app or something that you kind of plug in, and it just kind of naturally.
It'll take you 4 years to figure it out.
Right, naturally distribute. And I know Goodwill in Muskegon was the hub for us, and they were working on a lot of that back end side to make sure that the money was flowing properly. Eventually, I believe Traverse, the administrator up in Traverse City,
United Way of Northwest Michigan.
Northwest Michigan, ended up taking it over for the entire state. I can disagree with things. But eventually, I think it's kind of worked out that it kind of got put in a centralized. I always envisioned it more regional and local to help facilitate those payments, but it was one of those things you kind of figure out as you're moving forward of how to make that work properly.
Yeah, I think moving to the statewide administrator at the end of the day was the right move, because what had happened with the hubs is like everybody was doing it a little bit different, and when you have everybody doing it a little bit different, then it can be a little bit messy. And so having someone who was kind of that central point to make sure that everybody was hitting the benchmarks the right way, that the money was flowing out the door at the same time, that the benchmarks were being created within the department seemed to be the answer at the end of the day. And so I agree, when it first started, it was supposed to be more locally controlled, if you will, and have that input. But you learn as you go. And this was probably the best way to go, and I think has served the families and the providers well in having that centralized system so that there can be accountability throughout the whole process, and everybody has to follow the same process and rules at the end of the day.
And if I can just quickly add, this isn't necessarily an administrative piece that would make it easier for child care providers, but a couple of points that Kelly, you even mentioned one of them earlier, lifting up the profession and really continuing to elevate it as the valued role it plays in our society and in our economy will hopefully get more people into the field. Thinking about pathways and support for training, there are some great things happening, more that can be done. So helping the path to becoming a child care provider be easier and more supportive for people. And then, of course, compensation. I know I've mentioned that, but it's worth mentioning again that it's such an underlying challenge that it's a profession that deserves higher wages.
So this is going to be our last question, and if we can answer it briefly.
Yes.
Thank you so much. Really great conversation. Just appreciate you all so much for what you've brought to this. And Megan, thank you for your leadership at the WK Kellogg Foundation. My name is Rob Graham with the WK Kellogg Foundation. So I just shout out to Megan. So,
thank you, Rob.
I just there's a little bias going on
Do
here.
you
So
report
I get it,
to
right?
Megan?
Yeah.
No, I'm just kidding.
This question actually may be for you, Beverly. I'm curious, with HR 1 that passed last year, it's a very complicated bill with a lot of disparate impacts to different communities. And certainly those at the lowest end probably are maybe with SNAP and Medicaid having a little bit more challenges in terms of getting access to childcare. But one of the things that the bill did do was on the tax side was to expand the credit from 25% to 40%. Mm-hmm. Has that been part of a marketing or helping to at least provide some additional opportunity for businesses to be able to afford to get into this kind of a program? I'm just curious what the interaction has been.
So we are lucky to have our deputy director for early childhood in the audience.
Answer that one.
And so Emily Laidlaw, she's going to answer that for us.
Hey, Rob. It's odd to talk to you through a microphone this close. So we've been following that credit closely, and I think we are waiting for guidance on how to implement it, but it's really exciting to see that credit expand greatly, and we're really thinking about it in terms of how we can pair it with innovative solutions such as TriShare, and really move the needle forward with the vision that these incredible individuals have laid out.
So as we close, I have one more question for the panel. And in 1 minute or less, I'd like you to share what is a clear takeaway that you would like this audience to be able to take with them and be moved into action. We'll start with Megan.
So I think one of the most exciting things about TriShare is that it has engaged a broader audience in the conversation. You've got government talking about it, you've got business leaders talking about it, philanthropy, communities, and so it's such a huge opportunity that we've increased awareness with TriShare that let's continue working together to show that this is an essential piece of our economy. It's infrastructure that's needed for Michigan to thrive, for children and families to be successful. So now that we're all talking about it, we can do more about it.
So I would say that, for many of us, we watch TV or don't. And the world can feel real ugly sometimes. And so what I love about TriShare so much is that this is the good stuff. You've got the legislature, business, and philanthropy putting on display what can happen when we don't give in to the ugly. And so as we walk away from today, I would say there's a lot that we can do together that is not partisan in any sense. Childcare is not partisan. And so let's use it as an example to continue to innovate and to grow together to do great things like childcare and to all like TriShare for childcare. But then also let's not be quiet about it. We saw that the nation took notice when we did something like this, and we can do more things together in this space if we just make sure that we stay committed to each other and to making sure that Michiganders have access to great things like TriShare.
Yeah, I think mine's kind of a combination of those. It's kind of a West Michigan, I think, kind of thought, but we talked about, it was personal, private, and public, right? The 3 Ps is what we always talked about. And it was about having people also have skin in the game, right? That gets the engagement. It was not only the personal side, but it was the private side too, that once they got engaged. And I think that will also increase the level of child care. When you are paying money, not only the parent, but also the employer, I think that will eventually create better child care offerings because that money is engaged, their money is engaged. And kind of to Kelly's point of there is things that are happening. There is good things that are happening. And, maybe it's my Dutch upbringing as well, but I'm a little quiet about it. I try not to be braggadocious. I think that's how we were all raised out there.
I'm Dutch too, but I guess I went rogue
So
today.
we don't talk about it very much, but there is things that are happening. There is people that are working on issues that are important. And a thing like this, and one of the issues we had was not many people knew about it because something like this isn't going to capture the headlines of the newspapers. So it kind of took us a while to get the word out and get it to people, and working with the chambers and other organizations to get people engaged on it. So, there is people working on complex issues, and hopefully in the end of the day we can get them done, and whether they get the limelight or not, but knowing that it is helping families, as you opened up today, it's helping families and helping kids.
Well, thank you. Thank you for being here. Thank you for your leadership, your commitment, and your passion for Michigan's families. Let's give them a hand. And thank you as well for being here. We know that we need to sound the bell so that everyone understands this is an important program, not just for Michigan's families, for Michigan's businesses, and that MyLeap is committed to leading the way to ensure that we have many different types of child care options for Michiganders. Thank you so much again for being here.